Hi, Tony again with Alamo Slim Clinic. I want to make a quick video just to talk about the GLP-1 medicines, again, Semaglutide, Tirzepatide, and the subject matter today is what side effects might there be on these medicines? And secondly, are there any contraindications? Is there any reasons I couldn't take these medicines? And I'll start with that first. Yes, there are reasons you couldn't take this medicine or get approved by our doctor. Namely, they are if anyone is breastfeeding or pregnant, no for sure. Secondly, any cancers or serious issues with your endocrine system. That's the liver, pancreas, gallbladder. A lot of people say, well, I've had my gallbladder removed. That's fine. They're worried mostly about cancers, pancreatitis, cancer of the liver, cancer of the thyroid. A lot of people have a hypothyroid condition. That's okay. The doctors usually let that go through and would approve you for the medicine, but not any cancerous thyroid situations in your family history. So those are the big ones. Anything with your endocrine system, pancreas, or breastfeeding, pregnancy, those would say no. High blood pressure is okay. High cholesterol is okay to take these medicines. Typically, the doctor's going to approve you on a case-by-case basis. This video is more just the big picture of what automatically would exclude you would be the endocrine system, cancers, as I've mentioned, and or breastfeeding and so forth. Now let's talk about side effects. Everyone, of course, anytime you're taking a medicine, we want to be concerned about what side effects might you have. Most of the side effects on GLP medicines are gastrointestinal. What does that mean? Mostly nausea, maybe some stomach cramps, diarrhea, constipation, acid reflux are the big ones. Now, it's usually mild and it's usually only the first couple of weeks. Most patients get over it very quickly. A lot of patients have no side effects. But if you're going to have any, it's these. What are some of the reasons for that? Remember, when we talk about GLP-1 medicines and how they work, they slow down your gastric emptying. So they slow down your digestive system. So if you think about that deeper, that means this food stays in your stomach longer. So the doctor always recommends that you eat smaller portions. You're going to feel full by eating a small portion. You don't need to eat a lot. Our bodies don't need as much food as we eat. That's the reason we're going to lose weight. We eat smaller portions. But if somebody goes and eats a whole bucket of chicken, you're going to have some serious acid reflux and maybe some stomach cramping because it's going to take forever to digest. We also don't want to eat late in the evening. You might not sleep very well if you eat a big meal late at night because of the slowing of the digestive system, and all of a sudden you lay down and you get some acid reflux. We want to stay away from fatty foods, fried foods. You want to eat baked, grilled, not deep fried. That oil is hard to digest. It's going to sit in your stomach forever. So if you eat the proper diet that we recommend, and we give you a list of the good things to eat on these medicines and the things to stay away from, you'll be in good shape. If you don't listen and you eat the wrong things or you eat too late, you might have some issues. But the acid reflux can be solved with over-the-counter medication, and the same with constipation. Because of slowing everything down, we want to drink a lot of water on this medicine to stay hydrated. That also prevents headaches. Some people say they have headaches on these meds, but usually that's because they're dehydrated and not drinking enough water. That'll help with the headaches and prevent them, and that'll help with constipation. Again, over-the-counter medicines usually solve that, and we can give you prescription for those kind of meds if you need. But as I mentioned at the beginning, most people don't have a lot of side effects on these medicines other than some mild nausea. Well, thanks for tuning in. We'll talk to you again soon.